Let's continue with data method and application. In this part of the study, the current theory application in 4 polyclinics in both hospitals will be explained and evaluated in line with the data obtained from the state hospital and private hospital. The study includes comparing the polyclinics system of two hospitals in terms of the time spent in the system, identifying the differences and focusing on the reasons. Let's look at the assumptions of the study consist of the following items. First one, arrivals to the systems are independent from each other. The second one, units don't abandon or switch queues. Third one, long queues do not deter units from waiting. Third one, the working speed of physician is constant over time. Fifth one, the demographic characteristics of the units have no effect on their admission to the hospital, examination and treatment processes. December 2010, January 2011, February 2011, and December 2012, January 2013, and February 2013 data were used from the pediatrics, internal disease, ear nose throat disease, and gynecology outpatient clinics of both hospitals in the study. These dates have been chosen because they are the dates when the most patients come to the relevant polyclinics. Choosing the aforementioned polyclinics is that the number of patient arrivals, in short, their density is higher than the others. In the analysis, the days and the hours when the patients come to the hospital were taken into consideration. Private hospital analysis results. In the private hospitals subject to the study, pediatrics, medicine, general surgery, chest disease, ophthalmology, obstetrics, ear, nose, throat disease, diet and dialysis, physical therapy and rehabilitation, a total of 16 polyclinics including neurology, urology, and orthopedics provide services. Years 2010 and 2011. It is seen that the average efficiency of the hospital's 4 polyclinics for the years 2010 and 2011 was 89.47%. The average time that patients spent in the system and in the queue for 4 polyclinics was 49.5 and 42.9 minutes, respectively. On average, the patients wait at least in the internal diseases outpatient clinic and the gynecology outpatient clinic. The data regarding in the child, internal medicine, gynecology, and ENT outpatient clinics of the private hospital are stated above. The system performance of the private hospital for these polyclinics indicates an effective service delivery. The time patients spend in outpatient clinics varies between 29.4 minutes and 66 minutes. 66 minutes is the total time spent in the gynecology outpatient clinic, 16.5 minutes above the average. In 2012 and 2013. Considering the analysis results of 2012 and 2013, it's seen that the average efficiency of 4 polyclinics of the private hospital, which was the subject of the study, was 91.67% during the months of the study. The average time that patients spent in the system and in the queue for 4 polyclinics was 51.2 and 45.9 minutes, respectively. On average, patients wait at least in ENT outpatient clinic and at most in a pediatric outpatient clinic. The data of the pediatric, internal medicine, obstetrics, and otorhinology outpatient clinics of the private hospital are stated above. The system performance of the private hospital for these polyclinics indicates an effective service delivery. The time patients spend in outpatient clinics varies between 32.4 and 74 minutes. 74 minutes is the total time spent in the pediatric outpatient clinic. Public hospital analysis results. Brain and nerve surgery, pediatric surgery, child health and disease, dermatology, infectious disease, physical medicine and rehabilitation, gastroenterology, general surgery, thoracic surgery, chest disease, ophthalmology, internal medicine, gynecology and obstetrics, cardiovascular surgery, cardiology. There are 21 polyclinics in noise and throat disease, neurology, orthopedics, and traumatology, plastic, reconstructive and aesthetic surgery, physiatry, and urology. Years 2010 and 2011. The average efficiency of 4 polyclinics of the state hospital, which is the subject of the study, is 89.85%. The average time that patients spent in the system and in the queue for 4 polyclinics was 36.45 and 27.60 minutes, respectively. On average, the patient wait at least in the pediatric outpatient clinic and the gynecology outpatient clinic. The data regarding the child, internal medicine, gynecology, and ENT polyclinics of the state hospital have been stated above. The system performance of the hospital in terms of the polyclinics indicates an efficient service. The average time patients spent in outpatient clinics range from 28.2 minutes to 49.2 minutes. Years 2012 and 2013. The average of 4 outpatient clinics of the state hospital's efficiency is 89.19%. The average time that patients spent in the time system and the queue for 4 polyclinics was 23.5 and 14.6 minutes. On average, the patient waited at least in the internal medicine outpatient clinic and the most in the pediatric outpatient clinic. The data regarding the child, internal medicine, gynecology, and ENT polyclinics of the state hospital have been stated above. The system performance of the hospital for these polyclinics indicates an effective service delivery. The average time patients spend in outpatient clinics range from 28.2 minutes to 17.4 minutes. 2010 and 2011 public hospital, private hospital comparison. Looking at the analysis results of the pediatric outpatient clinic, it is seen that the efficiency rate of the private hospital is higher than the state hospital. The efficiency rate of the private hospital is 92.2%, while the state hospital is 84.14%. On the other hand, patients spend less time in the state hospital, while every newly arriving patient finds a total of 12 patients who are waiting and receiving service in a private hospital. This number is 6 in the state hospital. Considering the internal medicine outpatient clinic, it is seen that the number of service channels, which is 1 in a private hospital, is 3 in a state hospital. Despite this, it is seen that the efficiency rate in the state hospital is higher. This indicates that the density rate in the state hospital is higher. The efficiency rate of the state hospital is 92.99%. It is 84.38% for the private hospital. In contrast, patients spend less time in the private hospitals, while every newly arriving patient finds a total of 5 patients who are waiting and receiving service in a private hospital. This number is 14 in the state hospital. The number of service channels in the obstetric and gynecology clinic is 2 in the private hospital and 3 in the state hospital. The results of the obstetrics and gynecology outpatient clinics of both hospitals are very close to each other. While the efficiency rate of the private hospital is 93.8%, it is 92.4% for the state hospital. Patients who come to the obstetrics and gynecology outpatient clinic spend more time in the private hospital, while every newly arrived patient finds a total of 14 patients who are waiting and receiving the service in a private hospital. This number is 13 in the state hospital. There is one service channel for ENT polyclinic in the private hospital and 2 service channels for the state hospital. Looking at the ENT polyclinic results, it will be seen that the efficiency rate of the state hospital is higher. While the efficiency rate of the state hospital is 88.41%, it is 90.25% for the private hospital. At the same time, patients spend less time in the state hospital, while every newly arriving patient finds a total of 8 patients who are waiting and receiving service in a private hospital. This number 10 in a state hospital. Considering the pediatric outpatient clinics in both hospitals, it is seen that the efficiency rate of the private hospital is higher than the state hospital. While the efficiency rate of the pediatric polyclinic of the private hospital is 97%, it is 89.25% for the state hospital. On the other hand, patients spend less time in the state hospital, while every newly arriving patient finds a total 32 patients who are waiting and receiving the service in a private hospital. This number is 9 in the state hospital. Let's looking at the internal medicine outpatient clinic. It will be seen that the number of service channels, which is 1 in a private hospital, is 3 in a state hospital. While the efficiency rate of the state hospital is 91.16%, it is 94.68% for the private hospital. While every newly arriving patient finds a total 17 patients who are waiting and receiving service in a private hospital, this number is 8 in the state hospital. The number of service channels in the obstetrics and gynecology clinic is 2 in the private hospital and 3 in the state hospital. While the efficiency rate of the private hospital is 90.76%, it is 86.36% for the state hospital. While every new patient who comes to the clinic finds a total of 10 patients who are waiting and receiving service in a private hospital, this number is 11 in the state hospital. There is one service channel for the ENT polyclinic in the private hospital and 2 service channels for the state hospital. Looking at the ENT polyclinic results, it will be seen that the efficiency rate of the state hospital is higher. While the efficiency rate of the state hospital is 90%, it is 85.41% for the private hospital. At the same time, patients spend less time in the state hospital, while every newly arriving patient finds a total of 8 patients who are waiting and receiving service in a private hospital. This number is 5 in the state hospital. Let's look at the conclusion and evaluation. Regardless of the sector, they operate in one of the goals of the business is to fulfill the needs of their units to their satisfaction. For this trinity of time, quality, and cost must be managed effectively. For this purpose, the use of scientific methods offers easy and effective solutions to business. They operate in one of the goals of the business is the satisfaction of the units is related to the service they receive, but also the time they spend. People exposed to long waiting times experience dissatisfaction due to the uneasiness of waiting and the decrease in the service quality. Imbalance in the service supply and demand and accordingly long waiting times are also valid for the business operating in the health sector. The lack of quality and the number of healthcare personnel to respond to patients who demand health services causes crowds in front of polyclinics. Based on the data of 4 polyclinics, namely pediatrics, internal disease, gynecology, obstetrics, and ear, nose, and throat disease, the time spent by the patients in the system and the efficiency rates of the hospitals were compared to the Q theory performance scales. In this study, a public hospital and private hospital were analyzed with queuing theory performance scales based on the time patients spent in their outpatient clinic systems. The queuing theory analysis result of the private hospitals and the state hospital showed the efficiency of both hospitals in terms of the relevant polyclinics was high. Polyclinics in both hospitals serve most of the time. Longer service periods in the private hospital cause longer waiting times. There may be many reasons why service times and time spent in the system are long or short. From the quality of the service to the inconvenience dimension of the units, whether or not physicians are experts in their fields, whether or not they have the education level to explain the patient's problems. There may be many factors ranging from the socio-economic development and cultural characteristic of the province, region, or geography in which hospitals operate. The important thing is to evaluate the quality, satisfaction, efficiency, and cost elements as a whole and to provide the optimum benefit. The optimum benefit will be shared by the people who manage the hospital units to benefit from scientific methods at the highest possible level. This is my references. Thanks for your attention. If you have a question, I would like to help you answer your question.